Hi guys, welcome back to another treatment video. So today we are doing laser hair removal. We're doing underarms and we're doing Hollywood, which is intimate area. I'm visiting Kerry at Skin Laser Clinic in Peterborough. She has been doing my laser hair removal for about 4 years now, and I get so many inquiries regarding laser treatments. So I thought, what better way than to give you a little bit more insight by bringing you along to a full appointment with me. You'll get to meet Kerry, learn a little bit more about the treatment, about the benefits of the treatment, and we'll go over a few of like the most commonly asked questions regarding laser hair removal. And yeah, just basically show you guys what to expect from a laser hair removal appointment. Kerry offers not only laser hair removal but skin treatments as well. So she offers a variety of different treatments, and her husband Sergio has also trained in tattoo removal. So I have seen him before for tattoo removal and I will be again, but they offer so many different laser treatments here. I mean, that's absolutely insane. And tattoo removal, I am actually seeing Sergio after this appointment for another consult on my finger. I can't see it, it's not zooming, I don't know why it's not showing you, but I've got a tattoo that I need removing again on my finger, so I'm going to go and see Sergio for another patch test because it's been years since I saw him, and I'm going to get that removed with him. But they offer a whole variety of different laser treatments. And it's not just Kerry and Sergio. Kerry's got 2 other ladies who work with her as well. So she really is growing, like that business is flourishing. Look at that. I know so many people who suffer with this sort of thing. And I actually do on my legs as well. So I might bring that up with Kerry today if she's got time. Mascara vision, insane. When I say she's the best at what she does, I'm not just saying it for fun of it. She genuinely is. I mean, that tattoo's hilarious. Whose tattoo choice is this? Ooh.
Hello.
Hello, how are you?
What is it that you started doing? So I started doing not laser but IPL 7 years ago.
What's the difference?
IPL is a different type of laser light, so it doesn't penetrate the same way as what my machine does. So I have 2 types of laser inside the machine, one Alexandrite and one Nd:YAG, so I can treat all skin types.
Okay.
Like for darker skin, you would want an Nd:YAG laser. It's the gold standard, like for basically being safe.
Right.
When I first started and I had the IPL machine, like the results were meh.
Right.
At best.
Yeah.
Like, and that was when I was like, okay, I need to invest more money. I need something that is better, that's stronger. And then I had 2 diode lasers, had them for about 4 years. And again, that was one of the newest technology what I had, but I just found the results again were they were good and I wanted it to be great.
Yeah.
And that's when 3 years ago now, 2-3 years ago now, I purchased this machine, which I could safely treat all skin types, which I couldn't with the diode.
Right.
I would be worried about treating dark skin with that. And now I can safely treat all skin types, and the results I'm achieving now, I'm getting clients done in fewer sessions.
Right, yeah.
And they're achieving more of a hair reduction. So as before, it could be clients were needing 10 plus sessions and getting maybe a 70% reduction. I'm achieving now between like 6 to 10 sessions and achieving more of like 80 to 95% reduction in the hair. And people are needing maintenance way less than they ever was.
There's less hair to come back.
Exactly. So
Yeah.
people are needing way less maintenance and going longer in between top-ups.
Yeah.
So it was worth the investment overall.
100%. Because me and you have talked about this a lot, about these pop-up clinics and professional, like, what do you call them? Not like brands, but these worldwide like clinics.
Yes.
The well-known ones. And I told you about the client who come in and spent like £10
Yeah.
per session.
Yeah.
and she'd seen no difference. And she told me that it hurt more as her sessions went on.
Oh God.
Whereas for me, because there's less hair, I find it's hurting less. It's becoming more comfortable.
Yeah.
But is it dangerous? Like, obviously you want to know, like you're the professional here, like you've got all this knowledge, you probably hear clients coming in with these like experience from elsewhere, but are there machines that would be more dangerous? Especially in terms of like with skin tone and all that sort of stuff.
Definitely.
Right.
So if the person that is not using the machine doesn't have the experience of how to not treat tan skin, and when I say tan skin, not naturally brown skin, more to do with sun exposure, then they can scar people for life if they treat them incorrectly, or if clinics and people using the machines don't know what settings to use, then I've heard of clinics lowering the settings to keep you, one out of fear, and also to keep you coming back. So you can then, if you're not feeling anything, then guess what? It's probably not working.
Yeah.
You know, people go, oh yeah, pain-free laser hair removal.
Wow.
I just roll my eyes because I'm like, it has to heat the hair up to 70 degrees to kill the root, and that feels spicy.
Yeah. Obviously, there's different types of, and you would say that price does reflect that in this industry.
100%.
Yeah.
Yeah. It's like,
I mean, £10 a session compared to like what's your average for underarms?
So underarms, it's obviously cheaper if you do it in a package. So roughly about £40.
Yeah.
And I think
crazy.
with the lasers, like my laser is nearly £100 laser. I can't be charging £10.
No.
I can't, because I won't make any money.
No.
You know, if you take off that and tax, I'll be making next to
and
nothing.
maintenance for it.
Yeah.
Because you have to maintain your machine. don't you?
Exactly that. It's like a car. You service a car, you have to service the machines, and things need replacing yearly to make sure that they are maintained. But again, are other clinics doing that? You know, if someone is, you know, jack of all trades, master of none, and they've got 50 different treatments and they've got a laser machine that yet they're using twice a week, are they going to be servicing it? Are they going to be looking after it the same way? Probably not. You know?
Well, it's quality, isn't it, at the end of the day?
Exactly.
When it comes down to things like this, it's just worth investing in. Move it. We'll move it where I need it. Thank you. Thank you. Right, legs open.
Legs open.
Oh, it's so glamorous, isn't it? The things we do.
It really is.
So, what's the most common reason you'd say somebody would get it done?
I would say probably because they've got more ingrown hairs and they get shaving rash, mainly for like confidence reasons, because they want to feel more confident and have something that lasts longer than say shaving or waxing. That's probably the main thing that I hear.
I think one of the most popular questions that I got before, when I've had people asking me about laser hair removal, it's been clients who are suffering with polycystic ovaries and this area. And I was having a little look in your book. Like the results are absolutely insane. I cannot believe that photo. You probably know which one I'm on about.
Yeah, I know.
Literally looked like a male's chin, didn't it?
Yeah,
it was that like thick and intense. But obviously, because I suffer with polycystic ovaries, we know this, don't we? And I've personally found that it's not actually, I don't think it's affected my treatment with you. I feel like I've probably reacted the same way as any normal person. Like, it's not grown back loads more, considering it's been about, 3.5, 4 years? We've been doing it. But for the majority of people who suffer with polycystic ovaries, I can't remember what it was that you said to me in terms of treatment, what they would expect to be doing frequently. So is it like the 6 sessions and then normally most people come back sooner?
So when people have polycystic ovaries, it's very different, because I can have like a range of different results. So I could say someone would need 6 to 10 sessions, and then after that they could come and see me every 3 months for top up. Some people go 6, some people can even go like the year.
Like me,
Yeah, like you. But there is others that their hormones are fighting me constantly, where I'm doing the treatment, but it's like their hair is so resilient and it wants to come back, but they will get such a massive reduction in the hair growth and nothing that they've had, like waxing or shaving, can get them that.
Right.
Only laser gets them to that point.
Right.
And then all they're doing is maintaining the results that I've managed to achieve.
Okay.
Rather than constantly having to shave every couple of days,
Yeah.
they could go months without shaving and then just need to come in to maintain those results.
Okay, because I feel like that's definitely me, like, especially with my legs.
Yeah.
I'll shave my legs like today, and then tomorrow they're already like not just like a little bit of stubble, like they have grown back a lot.
Yeah.
Like that's probably one of the main things for a lot of people. Like obviously you get your average person who just wants to be smooth, and then it's the people who suffer with polycystic ovaries who, not like they suffer more, but you know, like the hair is thicker, it's more uncomfortable, it grows back quicker, like the uncomfortability.
Yeah,
from
exactly
it.
that. And like the lady that you saw in my book, she had been, I would say, bullied in a way.
Oh, wow.
Like a few things she'd mentioned to me where like even men had made comments to her, and it absolutely broke my heart.
Yeah.
And even after one session, she was like, this has changed my life. That's the thing, like if you don't see results in one session, you're not gonna, like, that's what I always say to people.
Yeah.
You should see something even after the patch test.
Right, yeah.
So for her, she was like, I don't know why I haven't done this sooner. Now, she doesn't have that grey shadow. You don't see the thickness of the hair. It's literally, now I see her probably every 4 to 5 months just to maintain those results.
Yeah.
And before, she was shaving every other day.
Yeah.
So, you know, to go from that extreme to the other,
Yeah.
it makes like
It
a
is
massive
life
difference.
changing though. Like as women, like the last thing, it's like when I said to you about my stomach.
Yeah.
Like you just don't. It's just you don't associate that with like femininity, do you?
Yeah, exactly that.
Yeah. It's always that little bit itchier, but it's like I said to Craig on the way here, like it's a 20-minute appointment and I'm done.
Yeah.
And like I don't have to worry about it for ages. Would you say Hollywood is your most popular treatment?
100%. It would be either Hollywood or Summer on the Face.
Yeah. I actually don't know what I used to do before. Well, I had waxing for about a year before, didn't I? But the pain for waxing compared to this.
I know.
I was my appointment would be like an hour and 15 minutes.
Really?
Oh my god, yeah. Because obviously, like a Hollywood for waxing, like it's just a lot. I don't know, so much more compared to this, which takes you about 10.
No, I've never understood why people would wax them. This is an option.
Honestly, I think because like when clients ask me about it, they're like, oh, it's going to be so painful. I'm like, honestly, compared to waxing, this is an absolute breeze.
Yeah. And do you know what? I always look forward to clients coming that have been waxed.
Yes.
Because their pain threshold
Yes.
is always way better.
Yeah. And because we sit for so much longer when you have a wax.
Exactly. And then afterwards, they're always like, are you done? And I'm like, yeah. And they're like, oh.
That air blowing is to cool the area, isn't it?
Yeah. So the cool air just helps kind of counteract the heat that's heating up the follicle,
Right.
make it more comfortable for the treatment. That's why when I get a little bit lower, I tend to hold it a little bit longer because that area down there is always a little bit more sensitive.
quick, easy breezy as this is.
an easy breezy one.
Literally. But do you know what? Like, will this be? How many sessions have we done on underarms now?
I don't know. I'll have to look.
Fourth or fifth?
Yeah, it's not many.
Now I know that after we've done one, haven't we? And then didn't I have mine? Or did we do two and then have one?
I don't know if it was 1 or 2, and then obviously you fell pregnant.
So it would have been about a year and a half since I saw you. And they were like blonde, fine. I was forgetting to shave.
Yeah. Wow. Yeah, there's just probably like a few dotted
I
around.
know, absolutely insane. Is that where I missed it?
No, it's some of the hairs that actually pop out.
Oh really?
So yeah, you can smell the burnt hair.
Right, so I've completely forgotten. On average, is it 6 sessions most people are supposed to have?
So anything between 6 to 10 is
Okay.
the average. Like I could, for example, say you had 3 different areas. Like your underarms might need 6, your Hollywood might need 8, and your legs might need 10.
Right, yeah.
Like every area is so different when it comes to results. So I always say expect 10, and then
Yeah.
everything,
Like
anything
that.
lower,
As well.
yeah, particularly good results.
Really good results. And I think as well, like, because of polycystic ovaries, I was expecting to have to
Yeah,
do more, but I think sometimes that's better to expect more and then do less, like
exactly
you say,
that.
isn't it?
Yeah, I always, what is it, under promise and overachieve. And they said to me, oh, you only need this much, because I showed them this picture I want to achieve, like,
Yeah.
and she did it, and I was like, I don't really see any change.
Yeah.
And I was like, at all. And then when the swelling went down, it was like nothing had ever happened. But if she would have said to me on the day,
Yeah.
you need more,
Yeah.
I would have paid.
Yes.
But at the
Yeah.
time she didn't, and then I was disappointed.
Yeah.
And I think if you then kind of give people the highest, and then you can achieve.
Bring it down.
Yeah, and then it ends
happier.
up being exactly that.
100%.
Exactly that.
So how many weeks are we leaving between?
8 if we can.
Yesterday was manic. I literally had no chance to film and sort of update post appointment. So yeah, next day doesn't feel sore. You don't really feel anything at all, to be honest. And even during the treatment, it's not like a consistent pain. Like some of the hairs sort of like pop and feel like a bit of a twang, but it's literally during that second and then it's done. It's crazy really that they cover such a large area and so many hair follicles, but you don't really feel that much of it. So yeah, on a level of like 1 to 10, I'd probably give it like a maximum 7 when it hurts. And then next day, you don't really feel anything at all. Next day, you don't feel anything at all. The hair follicles start popping out over the next few weeks, and it's crazy to see. You're not supposed to pull at them, but it's so tempting to like ease them. If you've got any questions, let me know, and I'll put them forward to Kerry next time I see her. But thank you for watching, and I hope you enjoyed.